8 months to 18 years. The study period was between July 2013 to March 2023. Optimal structural outcome was defined as quiet eye with no retinal detachment or phthisis bulbi. Adverse structural outcome was defined as a quiet eye with no RD. Sorry, was defined as development of phthisis bulbi, RD, or the need for evisceration. Optimal functional outcome was defined as improvement in post-operative visual acuity to 3 by 60 or better. Pearson chi-square test was used with appropriate significance, that is p less than 0.05, to compare the mean visual acuity before and after treatment. Over here we can see the male. So we had 54 patients with 58 eyes. Males were 37 and females 17. In the age group, the highest presentation was between the age group of 6 to 9, having a prevalence of 27.78%, and the age group of 9 to 12 with 12 eyes. Right eye had a prevalence with 28 and left eye with 22 eyes. Bilateral presentation was seen in 4 cases. Demographic statistics, this is the graphical representation of the same data. Again, so duration of presentation, the most common presentation was between 15 days to 1 month, which is 15 eyes, a percentage of 25.86%. Also 7 to 15 days was 27.59%. Presentations with 3 months or more was very less common, with only 4 eyes presenting after 3 months of developing endogenous endophthalmitis. USG findings, 5 eyes showed the T sign, 10 eyes showed retinal detachment, and other findings were seen in 47 other eyes. So on histopathological examination, fungal growth was seen in 1 case, bacterial was seen in most of the cases, 16, and the other eyes showed no growth on histopathological examination. Staphylococcus aureus was the most common organism found on HPE, with Acinetobacter, Pseudomonas, Staph epidermis, Streptopneumonia having 1 or 2 presentations. Vision, perception of light was the most common presentation with the kids presenting. No PL was seen in 8 cases. Treatment procedure done, vitrectomy was the most common procedure done, which was done in 46 eyes, that is 79.31%. Enucleation was required in 1 case, and 6 cases had evisceration. So optimal functional outcome was seen in 19 eyes where the vision improved more than 6 by 60, which is a 32.76%. Optimal structural outcome was seen where patients did not develop any kind of retinal detachment and had normal intraocular pressure, which was in 36 eyes, that is leading to 62.07%. Complications post the treatment, 4 patients developed a retinal detachment, 3 patients had increase in their intraocular pressure, and corneal opacity was seen in 1 patient. So the total number of complications were 8 out of the 58 eyes. Optimum functional outcome, where the patients developed a vision of more than 6 by 60, was seen in 19 eyes. Optimum functional outcome at the duration of presentation in cases where the cases presented faster than 15 days was seen in 10 eyes. So optimum structural outcome for bacterial growth, we could see no RD in 12 eyes, phthisis in 4, and RD in 1 eye. So to conclude, we can say that endogenous endophthalmitis can happen in healthy children without any systemic manifestation. Blood and intraocular culture may be less positive. Early 3-port vitrectomy may help salvage good vision. Oh, sorry. I'm not able to access it. Just a moment. Yes. Yeah. The gram-positive organism is more prevalent, and low virulence organism and older age group are good prognostic factors. Yeah. These are my references. Thank you so much.
Thank you. Actually, I like your work. It's the sample size is actually not bad for children, and yes, for pediatric. And also, I like how you set the outcomes, and I like how you like focused on the outcomes during the presentation. So you really did a good job. A question, I think just the conclusion, one part in the conclusion, the part about vitrectomy, it's just the way it's stated. If I don't know much about the subject, I would go home saying endogenous endophthalmitis, the treatment is vitrectomy, which I think is not the case. Endogenous endophthalmitis, the treatment is systemic treatment,
Right.
and then local treatment and vitrectomy are good adjuvants. Just out of something that came to my mind. But good work. Thank you so much.
Thank you, sir. Thank you. Thank you.
May I request the next speaker, Dr. Salman